So I decided to become an EMT like the middle of my sophomore year, but you had to wait until you were 16. So as soon as I turned 16, I signed up for the class. I always kind of wanted to be an EMT because I always thought it was really cool, but I also am going pre-med in college, so I thought that it would help like my resume and my applications and stuff like that.
First, I went to EMR school, which is Emergency Medical Responder, and that was probably December of last year. But then after that, I found an opportunity to go to EMT class in Somerset, which isn't like everybody else does in Sussex, but I wanted to do it. So I went to school last year in January to May, and I became an EMT in May.
With being an EMT, I learned a lot about obviously medicine and like how to help people and stuff like that, but I also learned about teamwork and dedication and caring for people and empathy and everything like that.
I have worked with Lauren, I've gone on a few calls with her, and I really do like it because we're at the same level where we don't have like the experience that some of the people here may have, but we can work off of each other and give each other confidence that we did go through school and we know what we're doing. And even though we're young, we can work off of each other and we can treat the patient fine.
This is our bag that we bring on every call, and it contains like all the essential stuff like oxygen, suction. Doesn't contain suction, I just lied. It contains like, I don't know what it has. It has
everything.
It has everything that you would ever need is in this bag. And then this is your trauma bag. So if it's like a severe trauma, like a car accident or something like that, you usually bring this out. It just has more like gauzes and stuff like that. This is an AED, and this is portable suction. It really just like depends on the call. So some of them are like traumas where like you'll do like a full workup with like a whole trauma assessment, which you test every part of the body, you take vitals, everything like that. Some are just like transport calls where you'll get to the scene and then you just load the patient and go. You bring them to the hospital. Some are RMAs where like the patient is fine, like they don't need any medical care, and then they just sign a report.
What we do for the patient really depends on what they need. If it's an airway problem, we'll give them oxygen and take care of their airway. If it's a trauma, we'll attend to their trauma, bleeding, depending on what they need. But really, we're trained in such a broad aspect that whatever the patient has, we're able to take care of their basic needs to get them to the hospital, to get them the specific treatment they need.
I will hopefully not be an EMT for the rest of my life. I mean, it's a great profession and everything, but I'm hoping to advance my career and I want to go to med school and become a doctor. Hopefully, I'm going to be going to James Madison. And make sure there is no pulse, because if there is a pulse, you wouldn't use an AED. So once you decide if the patient actually needs the AED, you're going to open it up and turn it on.
Remove clothes from patient's chest. Look carefully at the pictures on the white adhesive pads. Peel one white pad from the gray case. Place pad exactly as shown. Press firmly to bare skin. When the first pad is in place, peel the second pad.
Once the pads are on, you press this red button, which would deliver a shock to the patient. Once the patient is shocked, listen to the AED and it'll tell you what to do next.